Well, good morning, Scott. I'm Dr. Tom Berger. I'm Executive Director of the Veterans Health Council, program of Vietnam Veterans of America, and I live in Silver Spring, Maryland.
Great. Well, it's great to have you here this morning, Tom. Thank you so much.
It's great to be here, Scott. As you know, partnering with organizations such as yourselves, the Men's Health Network, the Veterans Health Council, we're moving ahead on educating the veterans community as well as the professional healthcare community and veterans' families, of course, about the illnesses, maladies, and sicknesses associated with periods of military service.
Let's talk a little about the event today, because this is the second annual Time Out for Veterans Health event. Can you talk about the importance of this event and really what you've seen so far today?
This is such an important event, as you're aware, Scott. Over 70% of America's veterans do not use the veterans health care system. So it's really important that we have events like this, and not only in Washington, D.C. area, but throughout the country, to draw veterans in to get tested for these kinds of maladies and sicknesses and illnesses that they may have picked up while they were on active duty.
And can we talk a little bit about the value of the partnership? You know, there's 13 veteran service organizations. We've got the Redskins, we've got GlaxoSmithKline, we have our other health partners. Can we talk about the importance of that partnership to better serve veterans in the community?
Well, a good example of that partnership and how it works is, for example, the American Urological Association just published an article in their regularly published news bulletin stressing the importance of urological checkups, prostate cancer checkups, that sort of thing for veterans. Because prostate cancer is related to your service in Vietnam, for example. If you served for any period of time in Vietnam on the ground, you are eligible for compensation and benefits and health care if you come down with prostate cancer.
You know, as a member of the Veterans Health Council myself, just speaking to you as the executive director, I've seen the value and the power of really bringing diverse stakeholders together to really better address these issues. Can you talk about, you know, what you've seen so far in the movement with the Veterans Health Council and really where you see it going from where we are today?
Well, as I hinted at just a minute ago, the organizations themselves, such as yours, put out articles and that sort of thing to educate not only the veterans community, but the professional healthcare experts out there in the given area, and that's so important that the organizations such as yours get the word out there. And of course, it does have a political impact when we go to the Hill and that sort of thing. We can be mutually supportive of efforts to get the right kinds of healthcare legislation passed for our nation's veterans.
Let's talk a little about the value of prevention and early detection, as well as innovation, really making prevention, early detection a priority. Do you see that in practice here today at the event?
That's exactly correct. That's what we see. I mean, and it's so important, as you're probably well aware, so many of the costs of healthcare are associated with the acute side of the continuum, whereas if we put more effort, education, and money into the other side of the continuum, that is prevention, we could cut down on those long-term healthcare kinds of costs.
Right. So let's talk for a second here about the Washington Redskins and GlaxoSmithKline, really the two organizations that have helped make this day possible in partnership. Do you have a message that you'd like to share with them today?
Yes. I want to thank both GSK and the Washington Redskins for their effort in working to put together, as we said at the beginning of this take, this is the second annual. It looks like we're going to have a bigger crowd than we had last year, and that's the important thing, is if we can get the word out. So we really owe a tremendous debt of gratitude to both GSK and the Redskins for helping us and sponsoring us to do this event.
Great. Well, thank you, Tom. Thank you so much for your partnership and your service.
Thank you.